Today, the health advisor to the government of India, in fact, Professor Vijay Raghavan, said that a third wave of COVID is imminent, it is unavoidable, it is inevitable, but we do not know when it is going to come and we must be prepared for it. Now, this is cause of concern because right here, when we are still to hit the peak of the second wave, already a third wave has been predicted. How soon can we expect it? And more importantly, what really are we to believe now when it comes to the tracing, testing and treatment protocol? Because a lot of confusion has been created about that as well. For example, about whether a CT scan usage is advisable or not. What really is the protocol vis-a-vis the usage of medicines, of injections like remdesivir? The center, for example, AIIMS has said that it is out of the treatment protocol, yet day on day we see hospitals across the country prescribe it even now. What really should we be prepared for going into wave 3?
A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape it. And therefore, we should be prepared scientifically to take care of that. So B117, other variants like 617 are accumulating changes which show excellent vaccines, on which vaccines show excellent efficacy, but ongoing surveillance is needed and vaccine updates as we go ahead with new kinds of variants are inevitable.
You're watching the News Hour at 10, debate number 2 on Times Now, Super Prime Time.
Okay, joining us on the show, Dr. Harsh Mahajan, founder and chief radiologist, Mahajan Imaging, Dr. Arun Sharma, director, ICMR and NIIRNCD from Jodhpur, Dr. Shashankar Joshi, member of the COVID task force in Maharashtra. Dr. Sharma, I want to start by asking you, when Professor Vijay Raghavan says it is inevitable, what does that mean? How soon?
Yeah, when he says it's inevitable, that means it's going to come. How soon is something that cannot be predicted in terms of days, because the second wave is still going on, and the kind of pressure it's going to create on the virus will mutate further, and obviously it will mutate to improve its position against the human beings. And if that happens, then it depends on how do we behave, how fast we can vaccinate, how fast we are going to control with the help of COVID appropriate behavior. That is going to decide when the third wave is likely to come.
So, Dr. Sharma, is this going to be the third wave, the next mutation going to be more dangerous for us, or it's going to be more benign?
Well, that also cannot be predicted because the mutations happen in large numbers. Some of the mutations are favorable to the virus. If they gain the upper hand, then what happens that the virus's influence in terms of severity, in terms of its fatality and infectivity increases. But this is the pressure game of the mutations within the virus itself. Therefore, like when the first wave ended, we did not know that the second wave is going to be more vicious, more infectious, or with more severity. So it's not something that can be predicted in advance unless we understand the character of the particular mutations which are likely to cause the third wave.
But Dr. Joshi, do we have any handle at all on when we can expect it? We just know it is going to come. Is it going to be by the end of this year, in 6 months, 1 year, 6 years? I mean, sure, we will do social distancing. Sure, everyone will vaccinate. But at least people have to prepare for something.
No, I think we have to use some basic principles of public health and predictive logic. And if you go by that, for example, it is geography specific behavior of the viral strain and the behavior of people at large. So if you go by the current modeling, if we look at a prediction, for example, Mumbai city, we predict that somewhere in September we may be hit by a third wave and we might have a fourth wave after that. But it will also depend on degree of unlocking or degree of restrictions. If we remain in a state of partial lockdown, we will postpone it. For example, we had predicted a second wave between 25th of December and 26th of January. That got postponed by 2 or 3 months. So very clearly, if you look at history of pandemics from Spanish flu time, we clearly knew Spanish flu had 4 waves. And clearly we know that this COVID pandemic, till we don't saturate our population with adequate vaccine and herd immunity in place, which is above 80%, we will get another 2 waves.
Okay.
But we don't know when we'll get it. Or in most likelihood, Mumbai probably will have it somewhere in September, and probably it will be a much muted wave. It will be a smaller wave, and we predict that the population which will be affected is probably the population below 30 years, predominantly the pediatric population. And in that terms, we have already started our preparation in order.
Okay, that's heartening to know. Dr. Mahajan, yesterday we had the Health Ministry briefing say that do not do a chest scan because it could lead to cancer. Now, the thing is, I have personally had an experience where my first COVID test was negative, and it's only when somebody advised me to get a scan done that we even discovered that I had a patch on my lung. Right now, as it is, people are finding it very difficult to get their tests done. There is no access, reports come late. Many were going in for CT scan. If even that is not advisable, then how do we know whether we have COVID or not?
CT scan for the chest and COVID has certain specific indications. And one of those indications is not to make a diagnosis. The diagnosis still needs to be made by a RT-PCR test. But in given clinical conditions, when someone is symptomatic, has the features of COVID, the RT-PCR test comes negative, then the recommendation is to do a repeat RT-PCR test. If that comes negative, in that situation, if the clinical picture is worsening, then one may get a CT scan done, and that could be diagnostic. It is not the panacea, and it is not a diagnostic tool. That's point number one. Point number two, if RT-PCR test is done too early, when symptoms haven't even started, and that's what people are doing, it will come negative. Point number three, RT-PCR has a sensitivity of about 70 to 80%. So 20% established cases may also come negative. Point number four, in the current surge that we are having, where labs are getting overwhelmed with samples, labs which may end up collecting too many samples, then there can be a problem. One, how you've collected the sample. Point number two, how you've transported it. And point number three, how you've actually stored it. It has to be stored at minus 20 degrees centigrade. And if you've not stored it properly and let it sit there for 3 days, 4 days, because in many cases the report is coming late, then you may get a false negative. Again, I would say that in case someone has the symptoms of COVID, even if the RT-PCR report comes negative, consider in this pandemic situation that this is COVID. Isolate yourself, wait, do whatever treatment may be necessary as advised by your physician, get a repeat RT-PCR. If that is also negative, then get a CT done. Or else, if your oxygen saturation falls below 94...
What about those who are asymptomatic?
For asymptomatic, there's no
How
problem.
will they know if they don't?
I will tell you. I will tell you.
If they don't have access to an RT-PCR test.
I will.
Yes,
I will come to that point, and that's a very valid question that you asked. See, the incubation period of COVID-19 is 2 days to 14 days, with an average of 5 days. So someone who's got exposed to a person who is COVID positive, and first thing is isolate yourself. You've been exposed. If you get the infection, you may infect your family. Isolate yourself. Don't get a test done on day 1, day 2, day 3. That will, in most instances, come negative. Because the average incubation period is 5 days, the earliest you should get a test done if you're asymptomatic is the 5th day, ideally 6th day. Only then you'll pick it up. Otherwise, if you've done it earlier, you get a negative test, you feel you don't have the infection, and the infection comes later, you're going to spread it, you are going to become one of the super spreaders. So the timing of the RT-PCR test is also very important. Of course, if you get symptoms of fever, of sore throat, cough, even a running nose, today we are even seeing in this new wave more of abdominal symptoms, diarrhea even, then once the symptoms come, you can on that day itself get the test done, and most likely if you have it, it'll come back positive. So there are many,
all right, I'm very glad you put a specific timeline to it. This was very helpful. I think Dr. Joshi also wants to come in. Sorry to interrupt you, Dr. Mahajan. I think Dr. Joshi also wants to make a point.
Just one more thing, that this fact
Sorry, yes, please complete, Dr. Mahajan. Yes, go on.
Has got the imagination that chest CT will cause cancer is absolutely wrong. It will take many, many CTs over many, many months for cancer to be caused. Even in Hiroshima and Nagasaki, it took 20, 25 years and much more radiation. The CT scanners that we have of today give very little radiation. So please do not fear it, but don't overuse it, don't misuse it. Used in the right context, the benefits far outweigh the risks.
All right, Dr. Joshi, yes.
Padmaja, CT scan has become the next remdesivir. Okay, in that way, that CT scan has its utility because sensitivity of CT scan is better than RT-PCR only in select cases. As Dr. Mahajan was alluding to, 85% is the sensitivity of CT scan and 70% is the sensitivity of RT-PCR, and the rapid antigen is 50%. Currently, our labs are overburdened with a lot of molecular tests. And if the RT-PCR is negative and you have symptoms which are very similar to that of COVID, not only you need to isolate, but the clinician needs to take a decision whether it is a suspect COVID or not. The clinician should have the liberty to do a CT scan under medical supervision. I completely agree that this should not be done by the patients directly and preferably should be done between the 5th and the 10th day. And the most important thing we forget in all this is monitoring the 6-minute pulse oxygen saturation test. If we do saturation at baseline and then do saturation after a 6-minute walk test, and if there is desaturation, that is far more superior to pick up that occult or happy hypoxia, what a CT scan would have done on the 5th to the 10th day. And also the CORAD scores which are given on CT scans can be very misleading. People run from pillar to post when they see that score, and then another panic starts that they want to get admitted because the score is 8 or 10. So all that has to be dissuaded. The radiologists are very, very good.
Since you
and
mentioned
capable.
remdesivir, I have a question about that as well, and I really think a lot of our viewers would want it answered. Dr. Arun Sharma, already the All India Institute of Medical Sciences has said that remdesivir is not in their treatment protocol. Then why is it being prescribed in hospitals, government and private across the country?
See, we have to understand the use of remdesivir. In the earlier days, when we started using remdesivir, there were certain favorable results seen, but it was not a trial. What was seen that the patients who are admitted with moderate to severe degree of disease, if they were given remdesivir, then their chances of getting into fatality or leading to death was minimized. It was relatively less. And the people could come out of ICU after 5 to 7 days of treatment with remdesivir, right? But later on, when the uses continued, it was proven that the utility of remdesivir is not as high as it was initially thought to be. That's why it has now been taken off that it is no significant advantage using remdesivir. That is why we are now changing the stand on this particular medicine. And just like if you remember what happened with hydroxychloroquine.
Okay, I think there are... all right. I think there are more questions vis-a-vis remdesivir, but every day we try and have this one section where only those questions are answered which are related to COVID. For the time being, I think this was very important, illuminating. Thank you, as always, all doctors, for having joined us with your wisdom. Thanks for watching. See you tomorrow.